think we have such a full agenda, we're just going to go ahead and get started. I'm RAPHI. All of you should have received some emails from me in the last week or so. Disregard the way my name looks, it's Eileen. Thank you all for coming and for signing up to be student observers. We really appreciate it. So just to get things started, we are videotaping this training to make it available for people who could not come in person to the training. So if you do not want to be on the video, please let us know. And if you're okay with being on the video, I need you to sign a video release form. If you don't want to be on it, I would recommend just sitting in the back, that sort of back corner. Otherwise, you'll be on the video. We're just going to use it for our own training purposes. It's not going to be distributed.
It's not going to be analyzed the way we use it.
No, not at all. And then just to let you know, I know some of you have already been directed, but the restrooms are, if you go out this door and go to the left, it's the women's restroom is on this side, and then if you go around the sort of gray, stonish wall, the men's room is on the other side. I think we thought it would be good to just go around and have everybody introduce themselves, since we come from many, many different places, and just get to know sort of the DOLPH research team here, and then so we can get to know you a little better. You all know me, and I'll introduce Dr. Scott Frank. He's the director of the Master of Public Health program here at Case Western. Actually, you have so many titles. I'll let you do it.
As we go around and introduce ourselves, please comment on what, if any, experience you have with local public health departments, so we have a sense of whether you've spent any time there or not. I have. My name is Scott Frank. I'm a MD physician and director of the Master of Public Health program here at Case Western Reserve. I've been here on the School of Medicine faculty for more than 25 years. So I am the founding director of the Master of Public Health program here. We're about a little more than 10 years old. And before the FPH program started here, I was in the Department of Family Medicine. And part of the reason that I'm in the role that I'm in is that for nearly 18 years now, I've been director of the Shaker Heights Health Department. So I have, the way I think of it, is one tentacle in local public health, and my octopus-like arms and legs, other tentacles in other places, but very familiar with local health departments because of my dual role. So that's where I'm coming from. Hi.
We have another graduate assistant, Michelle Menegay.
She's an integrated graduate studies student.
Oh, that's right.
Undergraduate degrees in anthropology.
Okay. Michelle, we're doing your introduction. I apologize.
Hi everyone, I'm Michelle. A little bit more? Or?
Yeah.
Okay, I'm a second year MPH student here at Case. I'm also a dual degree student, so finishing up my bachelor's as well. And I've been working with the program since May, and it's been a really great opportunity. And I'm also doing my capstone related to this project, so I'm getting knee deep into that at the moment, and I'm just really excited to get things going. So nice to meet you all.
Okay, so we're going to go ahead and get started. Everyone should have an agenda, and then in your folders we have some of the materials we'll be talking about later and for you to keep. What I'm going to talk about this morning is what is RAPHI, and then we're going to talk about the organization of local health departments in Ohio and nationally, and then we're going to get into what is the direct observation methodology. Okay, what is RAPHI? The Research Association for Public Health Improvement. It's an organized group of public health agencies engaged in ongoing collaborations with public health research centers to conduct rigorous applied studies designed to identify ways of improving the organization, financing, and delivery of public health services in real-world community settings. So RAPHI is a public health practice-based research network, a public health PBRN. We are one of 12 PBRNs that are officially funded nationally from the Robert Wood Johnson Foundation. Public health PBRNs are designed to support the development and dissemination of evidence-based public health practices with the hope that it results in improved performance, greater accountability, and more stable funding for local health departments. As I said, it's funded by the Robert Wood Johnson Foundation. The Ohio PBRN started in December of 2009, and we currently have funding through 2013. These are the public health PBRNs funded nationally. So the green is the first cohort. They were started in 2008. We're in the yellow cohort, which is January 2010 or December 2009. And then the blue or purple colors are affiliate PBRNs that are emerging, so they're interested and they have a core group of people committed to doing these projects, but they don't have funding yet. We have a National Coordinating Center at the University of Kentucky, which you can see at their Public Health Systems and Services Research Center, PHSSR. So what does RAPHI seek to do? RAPHI seeks to create an all-inclusive Ohio-wide public health PBRN, and it to improve the efficiency and efficacy of public health practice through research, which is what we're doing, what we're trying to do. Share research efforts among all Ohio health departments. Establish ongoing commitment to organizational structure. Investigate the scope of data sources common among local health departments, which we can talk about some of our other projects that are working towards that. Linking local health departments with investigators experienced in research, so that is absolutely what this project is doing. Facilitate involvement of health profession students, you. Assure that the nature of research conducted is driven by RAPHI members. And identify and act on funding opportunities that support public health PBRN research and RAPHI sustainability. So this is sort of a graphic of how we see RAPHI. So in the middle are all of the engaged groups and people, so research partners, public health practice, community partners, and then on the outside what we're working on. So identifying questions of common interest, applying the research methods, exchanging data, analyzing and interpreting the data, translating that data and applying it, and then from that starting again and going around. So RAPHI membership is open to the 125 local health departments in Ohio, the 7 public health academic programs in Ohio, the Ohio Department of Health, and the Ohio Public Health Partnership. And I should say that we have, I don't know the exact numbers, but we have a number of local health departments, not all 125 yet. We do have membership from all of the public health academic programs in Ohio, as well as the Ohio Department of Health and the Ohio Public Health Partnership. We have an executive committee for RAPHI, and the membership is the 2 principal investigators, so Dr. Scott Frank and Matt Stefanik, who's the health commissioner for Mahoning County. The project coordinator is myself. And then we have 1 representative from Academic Public Health in Ohio, Amy Lee from NeoMed. We have 1 representative from the Ohio Department of Health, 1 representative from a local health department in Ohio. We have somebody from the Columbus Public Health Department, a representative from the Ohio Public Health Partnership.
Can you explain what that is?
Sure. The Ohio Public Health Partnership is it's inclusive of all the professional organizations of public health in Ohio, so environmental health, nursing?
OPHA. Nursing is actually not
separate.
Formally a part.
So the Ohio Public Health Association, the Association of Ohio Health Commissioners, environmental health, a number of groups. So it's epidemiology. So instead of having representatives from all of those people, or all of those groups, we have just from the overarching organization. And then 1 representative from the Ohio Public Health Training Center out of Ohio State. This is just a screenshot of our website, but I wanted to remind everyone that we do have a website, and we will be utilizing it quite a bit during this project. It's www.ohioraphi.org. And what we'll have is we have a calendar, so you can see upcoming meetings. We'll be putting documents on there and reminders, and it's just to be sort of a one stop shop for everything.
You can see there is a DOLPH tab up there.
Five
so,
open local labs.
that may be where you tend to be going.
Mm-hmm. But we would encourage involvement in RAPHI in general, as well as DOLPH.
And I'd also say if anyone has any suggestions for things you'd like to see added to the website to make your job easier, just contact us. Particularly Purva has been the one who's created our website, so he's the best person to contact if you have suggestions for something that would make it easier to work with.
So that was RAPHI, and then DOLPH is a project within RAPHI. RAPHI has a number of other projects going on. DOLPH is one of them. So just to sort of explain the structure of the DOLPH project, we have the core research team here at Case Western, and then we have involvement from all 7 public health academic programs. At each of those programs, there's a site coordinator, and so that's who you'll be interacting with the most at your institution. And then we do have regular distance meetings. So we meet once a month via conference call. Twice a year we meet in person, once in the spring at the Ohio Public Health Association Combined Conference in Columbus, and once in the fall at the Association of Ohio Health Commissioners Conference. Most people are there anyway. We set aside a time one of the evenings and we meet in person. Each of the academic programs is committed to getting participation from 3 to 5 local health departments, and so that's who you'll be doing your observations with, one or more of those local health departments. And the local health department will also likely assign a liaison. For some it might be the commissioner or the health director, for some it might be the environmental health director, it depends on the size of the health department, and they'll be communicating with the site coordinator at the institution. And then 3 to 5 student observers per academic program to do the observations. This is just a timeline overall of the project. I'm actually going to blow it up a little bit so you can see it. So February 2012, it's cutting it off. Well, above what it says complete inter-rater reliability, it just says train student observers. So, and then we're going to complete the inter-rater reliability checks in the field hopefully this month. In March 1st, we're hoping to begin the official observations. So data collection and a statewide debrief of the process to see what's working, what's not working, check in with everybody and see what it's like for all of you in the field. April is continued data collection and recruiting some student observers for the summer. We realize not all the students will be around in the summer. We also have the annual Keeneland Conference, which is down at University of Kentucky, and that's the PHSSR nationwide conference. We'll go and report. Our funders are hosts to that. That's our National Coordinating Center, so we will present and talk about our experience so far.
And PHSSR is? Public Health Systems
and Services Research. I think I said that earlier, but we do, in your folder, we do have a sheet of acronyms, so a cheat sheet. In May, it's continued data collection, and then, like I said before, we have the OPHA Combined Conference in Columbus. All of you would be welcome to attend. We meet with, we have a general RAPHI meeting, and then we'll probably have a DOLPH-specific meeting. At that point, we'll launch the comparative case study, which we'll talk about later. It's part of this process. We'll also be paying the spring student stipends at that point, and training new or additional student observers for this summer semester. June is continued data collection, quarterly check-in with all student observers via conference call. Go to July, data collection. August, paying the summer student stipends and recruiting student observers for the fall for most programs. I think all the schools are going to be on semesters next year, I believe. And then September, data collection, training the new students, and then we do have the AOHC conference in Columbus and doing a statewide debrief. October is data collection, and then we'll be participating hopefully in the APHA conference in San Francisco. November is continued data collection, debriefing the project, and to pay the fall student stipend. So we're hoping to do a close date on these December 1st. So we'll have gone from March 1st to December 1st, capturing all of the seasons. So the role of the student observer, completing the student observer training, which you all are doing, and then observing sanitarians conducting routine inspections. We expect about one observational session per week, which would last 3 to 4 hours, and that would not necessarily be one inspection. That could be one, depending on the size of the facility where they're inspecting, or it could be 2 or 3. So you would go with the sanitarian to multiple locations. Some incentives for student observers. There's a small stipend associated with it. As we talked about, a lot of hands-on local health department experience, a lot of research experience. It's great for resumes. There will be opportunities for presentations and publications involving the data we're collecting on this project. And then, of course, networking for future employment if you do have any interest, which I know some of you do in working in a local health department.
Let me just add here that some of you may choose to complete this experience for curricular credit rather than a stipend. You can't actually be paid to do something that you're getting credit for, so you do have to choose between those two. But what I will say is that we will find other ways to spend the money for the stipend as an incentive for those students who are doing the curricular version, which is to say, for example, paying for membership to APHA and OPHA would be something that we could do for you in recognition of your participation that isn't considered pay, but does represent a real benefit to you. We'll talk about those kinds of things as we get a better sense of who's doing this as for credit and who's doing it for the second, who's doing it for other reasons, but would like to have a second as well.
And that's also something you'll work out with your individual institution and your site coordinator. Policies vary by institution.
Each of the individual institutions has its own budget, and there may be some differences in how the different academic institutions handle the incentive piece of this. There will be RAPHI-wide incentives, but the different schools may handle this differently, so do talk to your site coordinator. So that's the wrap-up for RAPHI and the overall project. Do you have any questions? It's a lot. It's a layered project and a layered overall process. I'm just going to introduce the direct observation of local public health, and then Dr. Frank will take over. And I don't know if you might talk about how we sort of came to this project and came to the observation of food service establishment inspections, but this is sort of the overarching. So the lack of credible evidence regarding the types and levels of workforce infrastructure, related resources, and financial investments in public health limit elaboration of a rational approach to changing the public health system in the face of health reform. That's the overall impetus for direct observation. And we can talk a little bit about how we came to student observers observing food service establishment inspections.